Before we begin, if this is the first time you visit to our channel, you consider to subscribe. Trust Dr. Channel Dr. Ez. Hepatitis C and the Hep C virus. What is hepatitis C? Hepatitis C is a liver infection that can lead to serious liver damage. It's caused by the hepatitis C virus. About 3.9 million people in the US have the disease. But it causes few symptoms, so most of them don't know. The virus spreads through an infected person's blood or body fluids. There are many forms of the hepatitis C virus, or HCV. The most common in the US is type 1. None is more serious than any other, but they respond differently to treatment. Stages of hepatitis C. The hepatitis C virus affects people in different ways and has several stages. Incubation period. This is the time between first exposure to the start of the disease. It can last anywhere from 14 to 80 days, but the average is 45. Acute hepatitis C. This is a short-term illness that lasts for the first 6 months after the virus enters your body. After that, some people who have it will get rid of, or clear, the virus on their own. Chronic hepatitis C. If your body doesn't clear the virus on its own after 6 months, it becomes a long-term infection. This can lead to serious health problems like liver cancer or cirrhosis. Cirrhosis. This disease leads to inflammation that, over time, replaces your healthy liver cells with scar tissue. It usually takes about 20 to 30 years for this to happen, though it can be faster if you drink alcohol or have HIV. Liver cancer. Cirrhosis makes liver cancer more likely. Your doctor will make sure you get regular screenings because there are usually no symptoms in the early stages. Things to clean this cold and flu season. Germs that cause colds and flu can live just about anywhere, especially places that you don't think to clean often. Here are 7 hotspots to disinfect. What are the symptoms of hepatitis C? Many people with hepatitis C have no symptoms. But between 2 weeks and 6 months after the virus enters your bloodstream, you could notice clay-colored poop, dark urine, fever, fatigue, jaundice, a condition that causes yellow eyes and skin, as well as dark urine, joint pain, loss of appetite, nausea, stomach pain, vomiting. Symptoms usually last for 2 to 12 weeks. How do you get hepatitis C? Hepatitis C spreads when blood contaminated with the hepatitis C virus gets into your bloodstream through contact with the blood or body fluids of an infected person. You can be exposed to the virus from sharing injection drugs and needles, having sex, especially if you have an STD, an HIV infection, several partners, or have rough sex, being stuck by infected needles, birth, a mother can pass it to a child, sharing personal care items like toothbrushes, razor blades, and nail clippers, getting a tattoo or piercing with unclean equipment. You can't catch hepatitis C through breastfeeding unless nipples are cracked and bleeding, casual contact, coughing, hugging, holding hands, kissing, mosquito bites, sharing eating utensils, sharing food or drink, sneezing, feeling sick. Tell us your symptoms and get help here. Talk with our cold and flu tool to get the answers you need. Symptoms of advanced hepatitis C. You could notice acute symptoms along with fluid buildup in the abdominal cavity, ascites, or the legs, edema, gallstones. Your brain doesn't work as well, encephalopathy, kidney failure, easy bleeding and bruising, intense itching, muscle loss, problems with memory and concentration, spider-like veins on the skin, vomiting blood due to bleeding in the lower esophagus, esophageal varices, weight loss. Hepatitis C risk factors. The CDC recommends you get tested for the disease if you received blood from a donor who had the disease, have ever injected or inhaled drugs, had a blood transfusion or an organ transplant before July 1992, received a blood product used to treat clotting problems before 1987, were born between 1945 and 1965, the age group with the highest rate of infection, have been on long-term kidney dialysis, have HIV, were born to a mother with hepatitis C, have symptoms of liver disease, got a tattoo or piercing with unclean equipment, or have ever been in prison. Continue reading below. WebMD. Polycythemia vera. Polycythemia vera is a rare form of blood cancer. Learn more about the symptoms, causes, diagnosis, and treatment of polycythemia vera at WebMD. Hepatitis C testing and diagnosis. Doctors will start by checking your blood for anti-HCV antibodies. These are proteins your body makes when it finds the Hep C virus in your blood. They usually show up about 12 weeks after infection. It usually takes a few days to a week to get results, though a rapid test is available in some places. The results can be non-reactive or negative. That may mean you don't have Hep C. If you've been exposed in the last 6 months, you'll need to be retested. Reactive or positive, that means you have Hep C antibodies and you've been infected at some point. You'll need another test to make sure. If your antibody test is positive, you'll get this test. HCV RNA, it measures the number of viral RNA, genetic material from the hepatitis virus, particles in your blood. They usually show up 1 to 2 weeks after you're infected. The results can be negative, you don't have Hep C. Positive, you currently have Hep C. Famous faces with hepatitis C. Ever feel like you're the only one who knows what it's like to have hepatitis C? This WebMD slideshow will introduce you to some famous folks who lived and thrived despite their condition. As part of the diagnosis process, you might also get liver function tests. They measure proteins and enzyme levels, which usually rise 7 to 8 weeks after you're infected. As your liver gets damaged, enzymes leak into your bloodstream. But you can have normal enzyme levels and still have hepatitis C. Treatment and medication for hepatitis C. If you have acute hepatitis C, there is no recommended treatment. If your hepatitis C turns into a chronic hepatitis C infection, there are several medications available. Interferon, peginterferon, and ribavirin used to be the main treatments for hepatitis C. They can have side effects like fatigue, flu-like symptoms, anemia, skin rash, mild anxiety, depression, nausea, and diarrhea. But hepatitis C treatments have changed a lot in recent years. Now you're more likely to get one of these medications. Daclastazevir, Daclinza. You'll take this pill once a day along with sofosbuvir for 12 weeks. Sofosbuvir velpatasvir, Epclusa. This daily pill, which you take for 12 weeks, should cure your disease. Ledipavir sofosbuvir, Harvoni. This once-daily pill cures the disease in most people in 8 to 12 weeks. Glecaprevir and pibrentasvir, Mavirae. This daily pill offers a shorter treatment cycle of 8 weeks for adult patients with all types of HCV who don't have cirrhosis and who haven't already been treated. The treatment is longer for those who are in a different disease stage. The prescribed dosage for this medicine is 3 tablets daily. Ribavirin, Copigas, Modariba, Ribitol, Ribasvir, Virazole. This comes as a tablet, capsule, or liquid. You take it with food twice a day, in the morning and evening, for 24 to 48 weeks or longer. Sofosbuvir, Sovaldi, with interferon and ribavirin. Take this tablet at the same time every day with food. You have to take it along with ribavirin and/or interferon, and you'll probably be on it for 12 to 24 weeks. Ombetasvir, Paritaprevir, Ritonavir, Technivi, you'll take this tablet by mouth, possibly along with ribavirin. Ombetasvir, Paritaprevir, Desabuvir, Ritonavir, Viekira Pak. This treatment is a combo of pills, 2 that you'll take once a day, and 1 you'll take twice with meals. You'll take it for 12 to 24 weeks. Sofosbuvir, Velpatasvir, Varxilaprevir, Vosavi. This combination is approved to treat adults with chronic HCV, either with no cirrhosis or with compensated cirrhosis, the stage of the disease that doesn't have symptoms, who've already had certain treatments. Elbasvir, Grazoprevir, Zepatir. This once-daily pill has cured the disease in as many as 97% of those treated. What are the side effects of hepatitis C medications? The most common effects of hepatitis C drugs depend on the medicine and often include flu-like symptoms, fatigue, hair loss, headache, low blood counts, trouble thinking, nervousness, depression. What are the complications of hepatitis C? About 75% to 85% of people who have it get a long-term infection called chronic hepatitis C. If the condition goes untreated, it can lead to cirrhosis, or scarring of the liver, liver cancer, liver failure. Can you prevent hepatitis C infection? There's no vaccine to prevent hepatitis C to help avoid getting the virus. Use a latex condom every time you have sex. Don't share personal items like razors. Don't share needles, syringes, or other equipment when injecting drugs. Be careful if you get a tattoo, body piercing, or manicure. The equipment may have someone else's blood on it. Can hepatitis C be cured? The goal of antiviral medications is a condition called sustained virologic response. If your blood tests negative for the virus 3 months after you complete treatment, you're considered cured. National Treatment for managing HCV in Egypt. In response to the major problem of HCV in Egypt, the Egyptian Ministry of Health and Population (MOH) launched the National Committee for Control of Viral Hepatitis (NCCVH) in 2006 to be in charge of combating HCV epidemic in the country. 17. The Egyptian NCCVH started its work by issuing the National Treatment Strategy for Controlling HCV Infection, which represented the roadmap for the activity of NCCVH. 18. Many stakeholders were represented in the NCCVH, including experts in the field of HCV from Egypt in addition to some international experts. 19. Based on the National Treatment Strategy, the main initiative tasks for the NCCVH were to estimate the actual HCV disease burden and develop a reliable infrastructure to function as a base for the National Treatment Program activities. 17. 20. The main challenge at that time was the high cost of antiviral medications, and thus, providing such medications for free, on the expense of the MOH, or at a highly reduced cost was the main pillar for attracting patients to the project. The infrastructure of the program relied mainly on establishing a wide network of specialized centers that provide integrated care for HCV patients. This integrated care includes all required services needed for HCV management, including screening, evaluation of the patients for their eligibility for treatment, administration of therapy, and follow-up during as well as after treatment. A well-trained multidisciplinary team, composed of hepatologists, pathologists, radiologists, clinical pharmacists, and all other specialties participating in assessment and follow-up, in each center is in charge of the management of patients. 17. These centers reached 64 facilities in 2018, covering the country with less than 50 kilometers between every 2 bordering centers, and were interconnected through a special dedicated intranet. The national network for treatment centers responsible for data transfer and other administrative issues, monitoring work progress, issuing treatment protocols, and overseeing these centers comes under the governance of the NCCVH. After the introduction of new direct-acting antivirals (DAAs), the story continued with obtaining these drugs at very low prices through negotiations between the NCCVH and the manufacturing companies. This allowed the treatment of a large number of patients in the first phase of the treatment program, and the number maximized to approximately 150,000 patients in 3 years after the introduction of the locally produced generic DAAs. As expected, such a large nationwide program represented a huge financial challenge to a resource-limited country like Egypt. The main funds for the program were through the governmental support funds issued to patients who are not under the umbrella of health insurance. 20. These funds were utilized for pre-treatment investigations, cost of medications, and follow-up laboratory tests during treatment. Results of HCV management in Egyptian real-life settings. The mass HCV treatment program started administering pegylated interferon and ribavirin between 2007 and 2014. However, the response to pegylated interferon and ribavirin was not satisfactory and was associated with many adverse events. In October 2014, the introduction of sofosbuvir markedly changed therapeutic outcomes. Rouane et al. Treated 60 chronic hepatitis C patients of Egyptian ancestry with sofosbuvir and ribavirin for 12-week or 24-week. In the study, sustained virological response (SVR) rates ranged from 68% to 93%, being more in patients who received 24-week of therapy. Similar results were obtained in Egypt by Dos et al. Who used sofosbuvir and ribavirin for treating treatment-naive and experienced patients. SVR rates were 77% in patients treated for 12-week and 90% in those treated for 24-week, with favorable response in non-cirrhotic patients. Egypt has all the potential tools to tackle its HCV crisis. What is needed is ring-fenced governmental funding to enforce treatment policy, as well as clear medical and public health guidance in order to target treatment effectively. At the same time, the Egyptian Ministry of Health must continue to invest in research and development for the best emerging treatments to be implemented. However, it is important not to forget the essentials of education, infection control, equipment sterilization, and risk aversion to stop further growth of those who continue to become newly infected.